everyone. Today we are going to discuss substance abuse and addictive disorders, so chapter 12 of our text. I want to take great care in presenting this issue because substance abuse and addictive disorders are a hot topic within families. Usually all of us know someone who have had a substance abuse disorder. For full enclosure, I have cousins who are addicted to heroin. I had a cousin who went to jail for creating, distributing, and using methamphetamines. I, not unlike you all, have had some personal experience with people with issues with substance abuse. So, I want to take great care in presenting this topic, especially if it's someone close to us. Now, I'm not really close to my cousins, but I know sometimes our parents are dealing with this issue. So if you or someone you know is having a substance abuse disorder, I can help you get the resources you need. With that being said, I'm going to proceed and make sure that when we're in our discussion board for this week, we are careful about our language with people who use substances or have substance abuse or use disorders. Because a lot of people use drugs, right? We're looking at what is the difference, what makes someone addicted to them. That's what we're trying to uncover this week. So for this PowerPoint, you'll see there's 36 slides. I'm not going to talk for 36 slides, but I will kind of hammer down the main points that I think we should take away. Because, let's be honest, I'm trying to give you the training wheels in education, so y'all should be reading the text, and not just relying on my lectures. So I'm going to keep this one succinct, because you got a lot of reading to do this week. I do recommend breaking it up into like 10-page chunks. With that being said, let me throw down some basic definitions for you to understand. Drug tolerance, withdrawal, substance intoxication, and substance use disorders. Now, you may have an idea of these, but let's look at the definitions, how we're going to use them. So, drug, any substance other than food affecting our bodies and our minds. So, there could be some that affect our minds more than our bodies, like psychedelic drugs, right? But these are often also over-the-counter prescribed drugs. You know, you take a Pepto-Bismol, that's going to be a drug to help with your stomach issues, right? So we think of illegal and illicit substances with drugs, but we're also looking at prescribed drugs because there is an issue with the opioid epidemic and prescribed opioids. Tolerance. So when you take a drug, usually it has some sort of effect on your mind or body. And this can be pain relievers, not the heavy dose opioids, but even ibuprofen. And if you take these long enough, your body will develop a tolerance to it. It's used to getting that amount, right? So once we reach that point where our body's like, yeah, that 2 pain med you're taking for your back, it's not doing it anymore. I need more. Your body says, I need more because I'm used to using that level and it's not working anymore. So we up the dosage. That's called tolerance. Our body gets used to a certain amount and it needs an increase for the same effects. Withdrawal. When something withdrawal, so you're thinking of someone who is using drugs, they try to pull out or pull back from using them. So unpleasant and sometimes dangerous symptoms occurring with drug stopping or cutting back. When we take drugs, our body becomes dependent on some level, especially if you have misused them or abused them. So when we take the drug, our body gets used physiologically to functioning with that drug in hand. So sometimes, like the case of alcohol, when we withdraw, we have severe effects and it could potentially be deadly. So sometimes people try to wean off as opposed to cutting cold turkey or stopping altogether right away. This is like what we see with babies who are born with heroin addictions, newborn babies who are addicted to heroin. They use a synthetic opioid at the hospitals to wean them off. Otherwise, it could have very severe effects on the newborn, despite the effects that may have occurred in utero. Then we have substance intoxication. So when someone's intoxicated, we think of kind of alcohol, right? But this can be any cluster of changes that occurs as a result of using any drug, any substance. And then substance use disorders. Now, a lot of people use drugs, and you'll see that in our TED Talk video. It comes to a point where we question, when does someone become addicted? What makes that different? Right? So with substance use disorders, we're looking at maladaptive behavior patterns and reactions caused by repeated substance use. So someone is repeatedly using or misusing substances. If you take a Benadryl to go to sleep, that is the misuse of the drug. You're not using it for its intended purpose, right? But then substance use and abuse is a whole slew of categorizations that we're going to look at our checklist next. But that's going to look at how drug use impedes our functioning, basically. So for that diagnostic criteria, we're looking at this checklist. Okay, I'm going to briefly skim through these. The individual displays a maladaptive pattern of substance use leading to significant impairment or distress. It is affecting their everyday life. Maybe they're thinking about the drug so much they can't assume their responsibilities as a parent, right? They value the drug over the interactions they have with their children because they're physiologically and psychologically addicted to the drug. Presence of at least 2 of the following symptoms within a year period. Substance is often taken in larger amounts or over a longer period than intended. So sometimes opioid addiction, so those heavy painkillers, starts from legally prescribed painkillers from the doctor. And in fact, you'll see that nowadays, just like 2 weeks ago, I forget what big drug company manufacturer was sued for billions because of their part in creating the opioid epidemic. We have an overprescription of painkillers. I remember I was in the emergency room. In fact, one of you saw me there because I hurt my ankle, and they wanted to prescribe me some heavy dose painkillers for what to me seemed like a minor injury. So that's where we're calling to question is, what are the roles of hospitals and doctors in creating the opioid epidemic? Now, that's a little anecdotal, but still, on a large scale, we're seeing this. There is, sometimes we're a bit too free with the prescription of opioids, and that's what's caused the current problem that we're in. Unsuccessful efforts or persistent desire to reduce or control substance use, so you want to get off of them, but you can't, and you've tried, but you're just not successful. Much time spent trying to obtain, use, or recover from the effects of substance use. Failure to fulfill major role obligations, so this could be at work, at school, or at home. Because of your substance use, you're ignoring your other responsibilities. And we also have the presence of at least 2 of the following symptoms within a year period. Okay, so this is continuing the previous list. So there's a lot of criteria you see. So someone you know may fit this, and it's a very difficult conversation to have. I will be honest, it's not easy. Continued use of substance despite persistent social or interpersonal problems caused by it. Cessation or reduction of important social, occupational, or recreational activities because of substance abuse. So you stop doing things. Basically, you stop doing fun things or the things you used to do because you're focused on using the drug or finding it. And you see how kind of this list goes on to talk about how it inhibits your life, as well as cravings for the substance. Tolerance effects, so we see that your body's getting used to it, and so you keep needing more and more of the drug in question, or having withdrawal reactions. And this is the good checklist to abide by. And if someone you know, again, you think could possibly be diagnosed with a substance abuse issue, it's better to intervene than to not, depending on your stake. When I was in undergrad, I took a course that was called Psychology of the Minority Experience, and we talked about how racial and ethnic groups differ in substance use disorders. And so this book puts it into a nice little chart, right? American Indians have 11.6% who exhibit substance abuse disorders. And this is a very high percentage and an issue that's talked about prominently. Typically, we see African Americans at 7.2%, Hispanic Americans 8.2%, non-Hispanic white Americans 8%, and Asian Americans at 3.8%. So there could be a whole slew of factors that affect these numbers, right? Maybe some people seek help more than others, or maybe some people, because I know in American Indian cultures, sometimes it's not acceptable to discuss feelings or emotional things with outsiders or people not in the family. So we have a lot of sociocultural influences, and sometimes unhealthy coping mechanisms are used as opposed to therapeutic approaches for dealing with different feelings. And how do we find these numbers? You know, how many people are using that we don't know? Or are these numbers based on legal kind of things? Because we see that some drug laws are applied unevenly amongst different groups. So that may skew the data. So I would really like to know where they got this data from. But it's a good representation nonetheless. One thing I want to talk about is just the different types of drugs. Oh, methods for taking substances. So this is just a good chart to show you different routes. People inhale them, snort them, inject them, and there are other routes such as mucous membranes. I remember when I was in college, I learned that some people were anally using alcohol by dipping it in tampons and sticking that into their rectum. Because of the mucous membrane located there, it would enter the blood vessels, the broken blood vessels. So there are many routes, and they can have different effects of the drug. So that's important to remember. There's not just one way to use. There are many ways to use. And so that's why sometimes it's so hard to diagnose substance abuse. If someone is using alcohol anally, you know, that is going to be harder to trace than someone you see actually drinking the alcohol. Right, because it's not detectable on the breath. And so it gets kind of difficult sometimes. But depressants are largely going to slow the activity of your central nervous system. And these are alcohol is one of the most widely used drugs or depressants, and especially in the United States, because we don't really see it as a drug. It's like a celebratory thing, but it gets perpetuated in media, and so its normed use kind of makes it seem like it's no big deal. So there are a lot of facts about alcohol and depressants that I want you to look at when you're reading, because we have this kind of stereotype that college students drink and party so heavily. But is that necessarily the case? That's what we want to look at. And we also talk about opioids and benzodiazepines and stimulants. So stimulants are going to increase the activity of the central nervous system. So kind of in opposition to those depressants. That's why I never got when people put Monster and alcohol together, because you're mixing a stimulant and a depressant, and I'm just like, I don't know if that sounds like a good idea. But there they do it, Red Bull and vodka. But stimulants are going to increase the activity of the central nervous system. So it causes rapid behavior and thinking. Caffeine is a drug. Again, its normed use makes it seem like it's not as big of a deal. But it does have a lot of effects. And so you'll see harder kind of stimulants such as cocaine. Also crack cocaine, so it can come in powder or crystallized form, different routes of ingestion, and different, this goes on a larger social scale, different laws apply to different forms of those drugs, right? It's very interesting to see how that affects people's rates of, rehabilitation, because rehab, I had my professor who was involved in substance abuse and helping people. She was a therapist, and she said, helping someone through substance abuse disorders and therapy is like a revolving door. They're going to keep coming back. There are cues, there are triggers that they will encounter in their life that may cause them to relapse, but we'd rather have them come into the revolving door than not at all. So kind of keep that in track as you go through. I'm not going to get into the specifics of the different drugs because I feel like this PowerPoint and our text lays them out really well for you all. But if you need a little cheat sheet, go through these and know the different types of drugs, know their effects, know if they're a stimulant. I would categorize them, right? Depressant, stimulant, psychedelic, and then kind of look at the subcategories because they're categorized as such based on their ranking on how addictive they are, as well as their effects, right? Their groupings are going to have similar effects. So caffeine, cocaine, amphetamines are going to have similar effects, but at varying levels. And cocaine is largely accepted to use on an everyday basis, whereas if I were in my office, I'm in my office having a coffee, that's normal. If I were in my office using cocaine, absolutely not acceptable, right? Things we have to look for. Then we also have like psychedelics, hallucinogens, that are going to be powerful sensory type drugs. They're going to affect our perceptions and our sensations. So we may have hallucinations, so seeing things that aren't there, but also hearing things that aren't there, tasting things that aren't there, feeling things that aren't there. Sometimes people will have acid or LSD, and they'll have a bad trip, and they may feel like bugs are crawling inside of their skin. And they may scratch and self-harm because they actually see crawling skin or bugs. So they can have serious effects. But I will say for hallucinogens, largely do not have like physiological ramifications. It's a lot of psychological. Whereas what we see with stimulants and depressants, we see psychological and physiological processes that are interfered with. Then we go in a bit about different hallucinogens. Cannabis is really interesting because it kind of falls into all of the realms. It is a depressant, a stimulant, and a hallucinogen, so it has effects of all of those classifications. So keep that in mind as you're reading. And so when we're looking at what causes substance abuse disorder, I'm going to continue that on part 2. I'll try to keep this only 2 parts, I promise. But stay tuned.